Welcome back. So, we were reading about growth and development in children. So, periods of growth, these are prenatal period, postnatal period, and adolescence. In prenatal period, ovum is from 0 to 2 weeks, and when it gets fertilized, it's called embryo from 3 to 8 weeks. And from 9 weeks to birth, it's called fetus. And perinatal period is from 22 weeks to 7 days after birth. Postnatal period are divided into newborn, infant, toddler, preschool, and school age. So, postnatal period, the newborns are those who are in the first 4 weeks after birth are called newborns. Infancies can be divided into neonate and post-neonate. Neonate is from birth to 28 days and post-neonate is from 29 days to 1 year. And the whole infancy period is from birth to 1 year, that is 12 months. Toddlers are from 1 year to 36 months. Preschool children are from 36 months to 72 months. School age is from 73 months to 12 years. Next, adolescence. These are early adolescence, middle adolescence, and late adolescence. Early adolescence is 10 to 13 years, middle 14 to 16 years, late 17 to 20 years. Let's talk about skeletal growth. Epiphysis or growth plate at the end of long bones fuse to the shaft or diaphysis. These occur at 18 years in girls and 20 to 22 years in boys. How do you estimate the bone age? Bone age is estimated by looking at the ossification centers. Mainly 20 ossification centers are used which include carpal bones, metacarpals, patella, distal and proximal toes in both the sexes, then distal and middle phalanges in boys, distal and proximal phalanges in girls. We look for in bone age, we look for maturity scoring for bone age. In that 50% of the score come from carpal bones, 20% from radius and ulna, 30% from phalanges. So to determine skeletal age, what do we do? Like in infants, we determine skeletal age from 3 to 9 months by looking at the radiograph of a shoulder. In children between 1 to 13 years, 1 year to 13 years, we look at the X-ray of hand and wrist. Usually left is preferred. From 12 years to 14 years, we look at the X-ray of elbow and hip. Now we'll look at the assessment of physical growth in children. What do we look at? We look at weight, length, standing height, head circumference, chest circumference, mid-upper arm circumference. So weight is usually children are weighed in either weighing pan or beam scale or third weighing scale. Then length of the children is usually measured for children who are less than 2 years of age by infantometer, and standing height for children who are more than 2 years of age with standiometer. Then you measure the head circumference, chest circumference, and upper mid-arm circumference. So now the weight. Average birth weight is approximately 3 kgs. In first few days of life, 10% of body weight is lost due to extracellular fluid loss. That is regained at the age of 10 days. That means birth weight is again regained at the age of 10 days. In the first 3 months of life, baby gains 20 to 40 grams per day. Then from 3 months to 1 year, they gain 400 grams per month. So basically birth weight doubles by 5 to 6 months, triples by 1 year, quadruples by 2 years, and sometimes usually 5 times in 3 years. So if you want to calculate the average weight of a child at 5 years, you have to multiply birth weight into 6. At 7 years, birth weight into 7. At 10 years, birth weight into 10. By the 3 to 7 years, they gain 2 kg per year. And 7 years until puberty begins, they gain 3 kg per year. Length and height. In length and height, the baby is born 50 centimeters at birth, 60 centimeters then the height grows as 60 centimeters at 3 months, 65 at 6 months, 70 at 9 months, 75 at 1 year, 90 centimeters at 2 years, and 100 centimeters at 4 years of age. They grow 6 centimeters per year until 12 years of age. Head circumference. Head circumference is usually 34 centimeters at birth. Then they grow 2 centimeters per month in first 3 months. Then 1 centimeter per month in 3 to 6 months. Then 0.5 centimeter per month until 1 year. So at 3 months, if we consider if the baby has 34 centimeters at birth, at 3 months they will be having 40 centimeters of head circumference if they grow 2 centimeters per month. Then 43 centimeters at 6 months, then 48 centimeters at 2 years, and 52 centimeters at 12 years of age. Chest circumference. Usually the chest circumference is 3 centimeter lesser than head circumference at birth. But at 1 year, the chest circumference is equal to head circumference, and thereafter the chest circumference is more than the head circumference. So that's it guys for today. Thank you.